Welcome back to McLaren Port Huron's Today's Health Program. Today I'm speaking with Dr. Brozovich about depression. Dr. Brozovich, we talked a lot about major depressive disorder. What other types of depression do you treat?
We did touch on persistent depressive disorder, which is a depression that lasts for at least 2 years' time, but is more, I guess, considered a lower grade depression as compared to major depression. There is also seasonal affective disorder, which we do see quite a bit of in Michigan. It's more of a depression that someone will feel at the onset of fall and through the winter. And then when the spring hits and during the summertime, they typically will feel better.
Is this related to the amount of sunlight that we have during those months?
Yeah, there is thought to be a correlation. And one of the treatments of that disorder is actually light therapy.
What other types of depression are there?
There is also what we call psychotic depression, which when someone goes through a major depressive episode, if it's very severe, they can often sometimes develop psychotic symptoms. And what I mean by psychotic symptoms is actually someone can experience some hallucinations, like maybe hearing voices, or they can experience delusional thoughts, which are fixed false beliefs. For example, someone might develop a lot of paranoid thinking, and we see this with depression.
So this is like a major depression that goes on untreated for a length of time, can actually cause psychotic features?
Yeah, that is true. Sometimes it's untreated and it just gets worse and worse, and when it becomes severe, typically is when we see it develop into these psychosis symptoms as well.
Now, what about postpartum depression?
Postpartum depression is a type of depression that a woman will experience after she delivers a baby, and yeah, we do see this type of depression, and it's very treatable. We treat it just like we would treat, for example, a major depression.
Now, you've talked today a lot about the symptoms of depression and the warning signs for suicide. What should our viewers do if they have somebody, a friend or a family member, somebody that they care about, that they are concerned, they think they may be depressed or suicidal and they are not seeking treatment? How can they help them to get treatment?
I think a family member can talk to the person who's experiencing the depression and try to encourage them to get help. Appointments can be set up in the outpatient clinic. Patients can present to their family physician for an appointment, or see a specialist psychiatrist or a therapist. If someone is felt to be at imminent risk of danger or of harm to themselves, the family member can always bring them to the emergency room 24 hours a day to be assessed. If the person who's experiencing the depression for some reason or another is not wanting to go to the emergency room or not wanting to get help, if someone's considered to be imminent risk, the family member can always contact the police, who can then check on the patient and make sure they're doing okay, or see what needs to be done if they need to maybe be brought to the hospital. Another thing that a family member can do is there is also a 24-hour emergency psychiatric services through McLaren Port Huron Hospital, and that number can be called 24 hours a day if someone needs some direction or is not sure what to do or how to handle the situation, or is considered for their loved one's safety.
Now, a lot of people out there, because of the stigma that's associated with depression and other mental illnesses, often that keeps them from seeking the treatment that they need. And a lot of times there's a concern with, are my records private? Will anybody find out about this? What can you tell us about that?
Treatment, for example, at McLaren Port Huron Outpatient Counseling Clinic is confidential. Someone can set up an appointment, and they should know that that treatment is going to be confidential. The only way that treatment records would be released is if someone gives their consent to do so. So the treatment is very confidential, and between the person experiencing the depression and the psychiatrist as well as the therapist.
Dr. Brozovich, this has been great information today. Do you have any closing comments for our viewers?
Yeah, for closing comments, I just really want to encourage, if you are feeling depression or suffering from depression, to please seek treatment. It's very treatable. We have a lot of different types of treatments to help. So never hesitate to treat, because it's best to treat if you catch it and treat it early.
Thank you for joining us today.
Thank you.
Stay with us. We'll be back after this break.